season is finally winding down, but the allergy season is already causing problems in North Texas. Dr. Crystal Foster with the Baylor Medical System joins us. So I know that Scott Padgett and I have really struggled with allergies and sinus infections. How can you tell if it's the flu, the cold, just hay fever, or something more serious?
So if it's just hay fever, typically you only have runny nose, watery, itchy eyes, maybe a little bit of congestion. But with the flu or sinus infections, you'll get fever, you'll get chills, you'll get body aches, you'll just feel really bad. So if you get those severe symptoms, make sure you check with your doctor, because we are still seeing some cases of the flu, even though they're a little bit more minor cases.
Well, we're glad that it's on its way out, though. So today's National Oreo Day. We've been talking about that, but the World Health Organization is they're changing their guidelines on sugar intake. Is that right?
Yes. Fortunately for our health, they are, but they're reducing our sugar intake to less than 5% of your daily calories. So to put that in perspective, for a person who eats 2,000 calories a day, that's less than 100 calories from sugar, including added sugar. So, and the same thing with 24 grams of sugar in your diet. So for a 2,000 calorie person, a can of Coke has 35 grams of sugar.
Wow.
So one can of Coke would exceed your daily sugar intake.
Yeah, well, and we definitely, with the obesity and diabetes and everything on the rise, we really need to be watching our sugar intake, obviously. So we know about the dangers of secondhand smoke, but there's now new research about smoking around children.
Yes, so there's new research out of Finland and Australia that studied about 2,000 children between the ages of 3 and 18. What they showed is that children who lived in a household where both parents smoked had changes in their carotid arteries in their neck. And those changes persisted even 20 years later after the initial study. And so the problem is the carotid arteries lead to your brain, and it can easily put you at risk for stroke. So now we're seeing passive smoke exposure may increase children's risk of smoke, even if they never picked up a cigarette themselves.
We're just constantly learning of more and more dangers and risks with smoking. So it's just so important just to never
to quit
start.
smoking.
And if you started, quit.
Yes,
stop.
Exactly. And we have so many ways to help you do that now, as opposed to even 20 years ago.
So many smoking cessation programs to get into, right?
Yes.
Thank you so much.